say that I live back in the state again, which I love, and more importantly, how much this event has grown and to be with all of you today. So I wanted to, just in a few minutes, I asked Gail to talk a little bit about our federal agenda, but I think on the top of everybody's mind is the bill that was passed earlier this month, and it's hard to believe, it seems like it's forever, was the One Big Beautiful bill, and frankly, its implications on senior living. Most of you were aware of some of the provisions that were in there. One that will be very impactful for a number of seniors is the new deduction on their Social Security income. You know, in the United States, the average is about $38,000 of income for senior income. So this deduction should apply to the vast majority of retirees in this country. A little closer to home, particularly for workers, is going to be the deduction for overtime income. You know, for a lot of years, it was almost a disincentive with the amount of taxes that were paid on overtime for workers. And I think the public is largely on this deduction centered around restaurant and hospitality, but this is available for anybody that's eligible for overtime income, including the senior living industry. We also saw some low-income tax credits, but I think the thing that was most important, the thing that we were most concerned about, was a reduction in Medicaid funding. That would have presented itself in the way most of you heard about FMAP. That is the Federal Medical Assistance Percentage. What that is most of you know that participate in Medicaid, particularly Medicaid assisted living waiver programs, is if there would have been a cut, because what the federal government does is it matches what the state puts in. Actually, it puts in a little more than what the state does for this. So our job one during this whole bill was to make sure that there was not a reduction with that. We had a lot of conversations. I spoke personally with the Senate Finance Committee Chairman, Senator Mike Crapo, whose first words to me were, and I can tell you, you probably encountered this in Florida, to find people that know exactly what assisted living is and not lump us in with other care settings is very key. And the first thing he said was, I know that you all provide great homes and that you save a lot of money for seniors. So that we had a lot of support to not cut, and in fact, we were able to escape the bill without any cuts. The one silver lining I want to tell you about that a lot of people aren't talking about, I think, is a tremendous opportunity, not only for Florida that has a very robust Medicaid assisted living waiver program, but so do a number of our states. In fact, over 40 states have a program similar to Florida in an assisted living Medicaid waiver program. And that is some language that is right here, make sure it's the right side, and that is a 1915C waiver expansion. And I underlined some language where this is the game changer. To participate in a Medicaid waiver program right now in Florida, as you do in any 1915C program throughout the country, your resident has to meet a nursing home level of care along with the financial eligibility. What this language will allow now is for states to establish programs that will not have to have them meet a nursing home level of care. What that is going to mean is we will still be able to take care of frail elders, but maybe ones that aren't quite at the level where they meet nursing home level of care, but also, more importantly, will discourage a spend down before they can get services. So we'll be able to get them services in a home and community-based setting earlier, which will certainly save federal and state government money, but more importantly, the quality of life for those seniors. So very early in the game, we are looking forward to conversations with the Department of Health and Human Services on this. But again, we think this will adequately fund it, allow more providers to participate, but also certainly more seniors to be able to be served in our communities. For our legislative priorities, I just want to hit on a couple because I only have a couple minutes, but we're trying to do some things that provide more access. So one of the things we're trying to do, similar to this 1915C expansion, is to look at ways where we can get people, before they have to get on Medicaid, some type of subsidies. We've got legislation that's got some bipartisan support that would provide a subsidy for low-income seniors that aren't quite at Medicaid financial levels. But also the second part of that bill is to, of course, which is job one for all of us, to encourage the federal government to put resources in to exploring ways we can expand our geriatric workforce. So those are two things that we'll be pursuing. Many of you are familiar with legislation we passed last year, along with other national and state organizations, that will, for the first time through a pilot program, allow seniors to be served through the VA long-term care system in assisted living communities. What our job is for this year is, rather than wait for this proof of concept pilots to take place, we want to have the VA extend what we think they already have the authority to do, and to encourage as many eligible seniors that are currently eligible for assisted living care to be placed right away. And the great thing that we have is all of you in this room have been providing, as most of Florida and the nation, care to our veterans in assisted living communities for decades. So this is something we hope to accelerate and obviously get our veterans in the least restrictive, more home-like setting as they can. By the way, the savings that the Veteran Administration calculated, right now, they spend on average for their nursing home care $120,000 a year. They estimate that they can care for somebody, some of those residents are eligible for assisted living care at about $51,000 to $55,000 a year. And you can see the delta with that. So again, we want to be adequately funded, but obviously, again, to have as many of our veterans that can be cared for in our assisted living communities as we can. And most of you certainly were very tuned into the immigration update. Particularly the one that's affected us the most has been the Cuba, Haiti, Nicaragua, Venezuela temporary protective status employees. Now, we've done a survey of our members. We have had some that have been affected. It hasn't been a large sliver, but enough that we're certainly, along with other organizations, going to do everything we can to try to talk the Department of Homeland Security into some type of carve-out for senior living employees that may be in these and similar programs. Now, one thing that you have not seen on a widespread basis that we think is a tribute to, obviously, the very careful and thoughtful management of foreign-born workers by our industry has been, you have not seen any raids at assisted living communities since the immigration orders have taken place. And in our conversations with the agency, that is attributed to a couple factors. One is the significant background checks that are conducted at the state level, many that have a national overlay to that. We also have a lot of providers that do the Verify program. And overall, just the I-9 management of these foreign-born workers has been something, and that is something that we'll do in our conversations and try to bring out to the Department of Homeland Security. Now, what makes this a little bit difficult is this issue has already been adjudicated through the courts. The Supreme Court upheld the Trump administration's ability to conduct these deportations. So again, really our last shot at this for this particular population is going to be direct talks with the departments, which we hope to conduct in the next few weeks. And then finally, what I want to conclude on is just some quality measures that not only Argentum, but in collaboration with NCAL, with Leading Age, and with the American Senior Housing Association, we rolled out last year model infection